then in regards to your neck, where do you feel it at in terms of that?
Right here.
And then you said the neck is up onto the top. Do you get headaches at all?
I get vertigos.
You get vertigo?
Yes.
Like, I'm gonna need a little bit of a push. Oh, there you go. There it is. Hey, yo. Your biggest thing is your hip and then your lower back, correct?
Yes.
Now, you said in terms of your hip, you feel where at again?
It's right here.
So on there?
Right here, yeah.
All right. And in terms of like the pain, it's not as much about like the pain, like a sharp or anything. It's more like a tightness, achiness. Okay. And it's more so right in this area here. Okay. And then in regards to your neck, where do you feel it at in terms of that?
Right here.
More up into the top there?
Yeah.
Okay. All right. And then do you get mid-back issues at all?
When I do this, I can feel, you know?
So more so right in
Right,
this
yeah.
area. Okay. So most of it's coming from that lower back and then onto that hip over here. And then you said the neck is up onto the top. Do you get headaches at all?
I get vertigos.
You get vertigo?
Yes, I
Okay.
get dizzy. I don't know. That's
All
part of
right.
it. Yeah.
It can be related sometimes with the spine. We'll see a lot of stress up onto the upper neck. Now those are really closely related to some of the stress in the ears. And the ears have the balance centers, and that can cause some of the
And
dizziness.
rings sometimes.
Yeah, also some ringing in the ears as well. And then also in regards to the upper neck, any issues down into your arms, into your hands?
The shoulder, right here.
Right over here? Okay, so more on this side
So,
over
yeah.
here.
And I always like crack it and I can hear it. You see?
Yeah, so you can
Yeah.
feel that cracking noise. Now, remember how we talked about when you have that kink in the mid-back?
Yes.
So looking at your x-rays, now that we have those x-rays, you'll see that your spine kinks and then it shifts to the left.
Okay.
Now, from the back of your spine, we can see that your shoulder on the right side is elevated. Your left side is down into the side.
Okay.
Now, your x-rays show that even more clearly as we look at that.
Right.
Now, a lot of times people will have that instability in the shoulders because of what's happening in the stress in the mid-back.
Okay.
Now, over time, like I mentioned, when people have stress in that mid-back, it can cause dysfunction of the shoulders, or at least the shoulder blades, and then that will eventually, in time, cause stress into the shoulders here. So frozen shoulders, bicep tendonitis, a lot of different stuff like that can happen. So a lot of times people address the shoulders, but they don't take care of the root cause of some of these issues here. All right, so we're gonna get you scanned with this guy here.
Okay.
We're gonna go from the bottom of the neck and work our way all the way up to the top here. Yeah. So we are seeing quite a bit of stress at that upper neck as well. Definitely more on that right side is where you're gonna see a lot of that inflammation over here. Looks like it's going to be close to your C2, C3 right there. Yeah, definitely your C2, C3 area. Take a look at what's going on there. So you said that you're a hairstylist, right?
Yes.
Yeah. How long have you been doing that for?
10 years, more than 10 years.
Okay. Well, and you said your specialty is really taking care of the
Yes.
special needs.
Yes.
That's really really such a cool thing that you're doing.
Yeah.
But I know a lot of my patients that really work with those with special needs. It's taxing on their body. It's putting more demand on you physically.
Yes.
And so you are going to see some of that stress start to happen. So what I'm doing is I'm just feeling for the area where it kind of dips, and you can actually feel right into there. So when that happens, we call that pitting edema.
Okay.
And so your muscle tone is really nice and intense here.
Okay.
But once you go right into this joint right here, that's where it kind of dips right into that.
Right.
So that's where you see swelling occurring in there. So I'm going to push right into here, leaning over to the left, over to the right. Any soreness right in there? Not too bad.
No.
So we have that L5 here, and that's when that kind of starts to sway to the left. But we also have your sacrum, which based on your x-rays, we're able to see that it's sticking up just a little bit more on that left side. So it's rotating out on this side here.
Okay.
And so that is going to cause some of that stress on your pelvis. So I know we feel it more down here on that right side.
Right.
Sometimes what happens is when it gets stuck and fixated on one side more, it's going to cause this to to work too much. It's going to cause that to flare up and aggravate.
Right.
So do we have pain on that right side here?
Ah, yeah.
Right there.
Right. Yeah.
And then onto the left.
The bottom. Yeah.
Down below
Yeah,
here.
yeah.
So both sides on the bottom, that's where you feel it. Let's take a look at your upper neck and see what's going on up here. Right there.
Yes.
Yeah, sore right
yes,
there?
right there.
Yeah.
Oh.
Okay, so that's the
I mean,
spot.
it's good sore. You know what I'm
Yeah.
saying? Not like a pain, but yeah.
It's like that's where it's at, yeah.
Yeah.
Okay, so what we're gonna see here is basically, so your spine up on the C2, it's rotating to the left and it's pushing that right side out. So when that spine, when it pops out to that left side, the right side sticks out more, and that's where you're gonna like, ooh, that's the spot right there. So we're gonna see if I can work on that to see if I can get that back into position there, and we'll go from there. All right, so let's go ahead and get you adjusted. Let's get you on the right side.
Okay.
So this is your 5, 1, 2. Let's go ahead and get that tailbone right on over here. Good. I'm gonna roll you quite a bit, okay? Relax that shoulder. There you go. Just like that. And let it go. A little baby movement. Just a little bit more in there. Let it go. There's the rest. Okay. We're gonna walk over to the wall, come back over to there, and we're gonna do that a couple times just to get some movement in that joint there. Okay. One more time over there, and go over to the wall. Now, just with that, how are you doing with that pose? You doing okay? Okay. Your T12. It's rotating over to that right, so we're gonna go ahead and push that back down over here. Deep breaths for me. All the way out. Nice job. Oh, that was a good one. And you're gonna go one more time to the wall and come on back. How are you doing on that? You feeling okay?
Yeah.
All right. Any difference in what you're feeling? What are you feeling?
Yeah, it's good.
Okay, good. We got one more for you, okay?
Okay.
You're doing a great job. Come on back. So the key to this is just to go on like a little mental vacation, whether it be Hawaii, the mountains, the snow, wherever you like to go.
Okay.
Where's your happy place? You like the snow? You like the mountains? You like the beach?
Yeah, beach.
The beach? All right, let's go to the beach together, okay? All right, now let your body just kind of relax here. I'm just going to go ahead and grab onto that C2 right on over here. We're going to bring your chin over to the side and give a little bit of a nudge right there. Now from here, I'm going to stabilize your neck. I'm going to get a little bit of a push just like that, okay? All right, so it can be a little sore, but I think you're going to be just fine with this, okay? So relaxing that shoulder. I'm going to need a little bit of a push. Oh, there you go. Nice. I always love the nervous laugh after. You're doing just fine. Go ahead and move the arm up and bring this out. Let's get you walk on that one more time. I'm going to go right here. Basically what we're doing is getting movement back into the joints, right?
Yes.
So we've got some really good adjustments on you. Have a seat right here. Let me go ahead and take a scan here. Now sometimes when we do the adjustments, you might feel some tightness just because your body's been this way for such a long time. Now the muscle's like, oh, something's different. So especially on your lower back because it's already tight here, as we shift and move some things, your body's going to start to relax. In the beginning, sometimes it can become a little more tense because it's a different feeling for your body. So now it's like, ooh, this is different. So it kind of goes in guarding mode. And then as it starts to figure itself out, it's like, okay, I can relax. It's doing better here. All right, let's go and scan you. Let's see how things are looking here. Good. Yeah, so there's still a little bit of pressure on there, which I expect to see, but it's definitely doing much better up on the top. Yeah, so it still shoots over to that right side, but over time we're going to start to see that thing start to clear out a little bit more. Yeah, so it's definitely reducing though, so I'm really happy to see that. Good stuff. All right, so we're making some good progress. So let me show you what we did. On your exercise, we did 3 things, right? The first thing was we worked on your tailbone. Again, that sacrum, it's kind of popped out on that left side. We're pushing that thing back in to set up for the foundation here, okay? The sacrum kind of squeezed right back into both sides of the ilium, and so it's the centerpiece, right? So when we move that joint, it's going to affect both sides, okay? Actually, not just only both sides, but it will also affect the spine on the lumbar spine here, okay? The second thing that we did was your T12. That's this guy right here. So your spine goes over to that left, and then it twists coming back in here. And then it kind of straightens up again and goes out to that left side. So we started with this one today on that T12. Again, there's a lot of stress happening in that lower back and that mid back. So when we work on these areas, your body is not used to that. So it's like, oh my gosh, like something's happening. So you can feel a little bit of tightness, some tension there, but then it should start to work its way through, okay? The last one that we did was your C2 up onto the top here. That's where you're kind of feeling it, where it's like, oh, like that's where it's at. So that C2, essentially what it's done is it's kind of rotating out to that left side. We're pulling that thing back in to reposition that here. So again, your spine, your neck, it's super straight. It's been that way for some time. So as we work on that, things are going to start to shift and undo here. I'm not expecting a miracle where your body's like back into that curve, but over time, we want to see some improvement there, okay?
Yes.
If you feel any soreness, tenderness, discomfort, that can be expected because we're shifting and moving some things.
Okay.
So ice if you need to, 15 to 20 minutes every couple of hours.
Okay.
The second thing is the work started in the office, the work continues outside the office. So when you're walking, getting some movement, your body's undoing the years and years of compensation and stress.
Okay.
That's pretty much it for today. You
Yeah.
did good. I'm so proud of you.
Yeah,
I'm
I
so
love it.
proud. Yes.